as Action Against AIDS Germany conducted these interviews in April 2022 for the preparation of our joint conference, Get Back on Track, the Global Fund's contribution to achieve the 2030 Sustainable Development Goals, that we organized prior to the Global Fund replenishment.
Our aim was to highlight the Global Fund's respect, contribution and support for community health systems as part of its approach towards health system strengthening. Thanks to Febbie from Malawi,
Mirinda from Indonesia,
and Ngulube from Rwanda.
My name is Ngulube. I'm coming from Malawi. I'm currently the Global Fund Her Voice Youth Ambassador for Malawi, and I also sit in the Global Fund Youth Council, and I also represent young people at the National Association for Young People Living with HIV. I'm a young person living with HIV, I'm an HIV activist, I'm also a PA educator. As a young person living with HIV, I have faced so many struggles when it comes to HIV. I've faced stigma and discrimination, and this really motivated me to support my fellow young people who are living with HIV and facing the same challenges that I faced. So I don't want them to feel neglected, but I want them to feel empowered. I want to be their model, role model. I can say currently, HIV is not the same as it was in the past years. Currently, we have the test and treat strategy whereby if a person is newly diagnosed with HIV, they are initiated ART treatment, and ARVs are fully available, and there are quite a lot of activities happening to support adults and girls and young women to make sure that they do not interact HIV. And adults and girls and young women are also empowered in different programs, in different Global Fund programs, and they're also kept in safe schools, and there are also interventions to make sure that they have access to safe sexual reproductive health services. Maybe I'll start with the Her Voice Fund, which is a Global Fund initiative. Her Voice Fund gives opportunity to adults and girls and young women take part in different decision-making processes, be part of the Global Fund implementation activities. You talk of the Global Fund funding request, implementation of activities. Adults and girls and young women are in forefront being part of these processes. And there is also a program of keeping girls in safer schools. Some Global Fund activities, districts in Malawi, adults and girls and young women are fully supported with their primary education, and that's why we are also here to advocate for a secondary and tertiary education support for these adults and girls and young women. And also we support adults and girls and young women to speak out whenever they are facing any kind of violence. Community health system strengthening, it means people should access healthy services in the community that they are into. They should have someone who is close to them, like for example, for a young person, if they want access to sexual reproductive health services, for example, condoms, they should have someone, a PA, to easily access these services. They don't have to walk a very long distance to just access a condom. Someone should be close to them to support them with those kind of services. And we want also community health centers to have enough services for young people, enough services for people in the community. They don't have to always be referred to a district hospital. ARVs needs to be available. Pregnancy emergency pills needs to be available. PrEP needs to be available. PEP needs to be available right in their communities. I can say currently we describe key populations in different groups. Firstly, we have age-wide abuse as one of the key vulnerable population. We have men who have sex with men as one of the key vulnerable population. We have people who inject in drugs. We have them, but because our government arrests them because of using drugs, they don't come out, they are dying in silence. And we also have the transgender. These are groups of key population who really need much of efforts and our support in our community, despite that the government or our community norms doesn't accept them, but it's something that we really need to understand that they are there and they need help. Currently, civil society organizations have stepped up to engage especially transgender people, to engage key population, men who have sex with men, in their programs. Though the government is not legalizing their existence, but CSOs are trying their very best. For example, in the Global Fund, in the CCM, Global Fund country coordinating mechanisms, we have a good representation of the key population groups that are there to contribute what works with them, though the government don't want to come open that they are working with them because of legal issues, but people are trying to support them, though the community also have a bad mindset towards them, but it's something that we just have to change our mindset and put in mind that they need support. They are the people who are also increasing the HIV prevalence rate by the end of the day through injecting drugs, having unprotected sex with their partners. That's the men who have sex with men normally. There are girls and girls and young women. They contract themselves in transactional sex just because they want to find the basic needs. There is no one to support them financially. There is no one to empower them. There is no one to keep them in a safer school, a safer community. COVID-19 has shown us all of these challenges that they exist. For example, in Malawi, we had a very high rate increase in sexual violence, and these violences were happening in the homes where these adults and girls, young women were coming from. The homes where these adults and girls and young women are protected, they're financially supported. That's where these girls were facing violence. And it's high time we need to empower these girls. We need to find something for them to do so that they can be standalone women. They can be empowered so that they can stand up and speak out whenever they face this kind of violence. The Global Fund is really trying its best to ensure that we target all vulnerable groups of people, including the adults and girls and young women and the key population. Despite our government structures, our legal challenges, but they're really trying their very best to ensure that everyone is treated equally. And the Global Fund is also making sure that in our countries we have medical equipment, we have ARVs available. In Malawi during the time of COVID-19, because we had we have quite a very good number of ARVs available, people were able to go to a healthy facility and access a 6-month supply of ARVs without any challenges, without any running out of stock of ARVs, and people were able to access different services whenever they want to. So it was really a very good intervention that we feel like should still continue. The role of the community, the CSOs in our countries is very crucial because CSOs are normally in the community. They are normally the first people to hear feedback from the community. They are the first people to know the challenges that people are facing in the community. And that's why we are even here today to to ask the German government to contribute at least 1.3 billion to ensure that much of that funding goes to the community. Any problem that comes in the country, it comes from the community. These are the people who try to address these issues at national level, but because they have limited resources, they are unable to support these programs.